Assalamu alaikum and good evening to you all. Welcome to the second episode of Masterclass for Medicine Final Part Examining organized by SCP Bangladesh Chapter and supported by Bangladesh Society of Medicine. As you already know, it's a program which is designed for the medicine final part examinee as well as midterm preliminary part 2 examinees. On the last episode, we had an historical webinar. Tonight, it's nothing different. Today's topic is one of the most talked about and important topic of our time. Today we will be learning about the vaccine passport. To talk about this important topic, who would be better than the best researcher of our country? Yes, he is none other than Professor MD Ridwanur Rahman sir. He is the head and professor of medicine, Universal Research Center. To chair the session, we have someone who is considered a true leader, one of the best physicians of our country, Professor Khan Abul Kalam Azad sir. He is the governor-elect, SB Bangladesh chapter, and the former president of Bangladesh Society of Medicine. In the expert panel, we have two most renowned and prestigious professors of our country. Firstly, we have Professor Mohammad Abdul Faiz sir. He is the professor of medicine and former director general of health. We have every student's favorite professor, Professor MD Zakir Hossain sir. He is the professor of medicine, TMSS Medical College, and founder chairperson of Hypertension and Research Center, Rangpur. As a moderator, we have the talented Dr. Pankaj Kanti Dutta sir. He is the assistant professor of medicine, Dhaka Medical College. During the live session, you can ask topic-related questions on the comment section. We shall try to answer them in the question and answer session, which will start right after the presentation. So, without doing any further delay, let me hand over the session to Dr. Pankaj Kanti Dutta sir. Dr. Pankaj Kanti Dutta sir. Sir, we cannot hear you, sir. Can you please check your
প্রফেসর
volume?
সিরাজ রুম কোনটা কয়তলায় তাড়াতাড়ি বলো আমাকে একটু যাইতে হচ্ছে করে
Sir, can you check your microphone, sir? Well, due to some technical difficulties, I guess Pankaj sir cannot be present here with us. I would like to request Professor Mohammad Ridwanur Rahman sir to start his valuable speech and talk. Professor Ridwanur Rahman sir.
I cannot hear anything.
Can you hear now, sir? Can you hear now, sir, clearly?
Sorry, I can't hear what you are
Sir,
telling.
Sir, can you hear now, sir? Sir, can you hear now, sir? Sir, am I audible right now, sir? Sir, can you hear us? Sir, can you hear me, sir?
এখানে ওয়াইফাই এর কি কত পাস দিয়ে এখন বুঝতে পারতেছি না যে আমাকে শুনতে পাচ্ছে।
স্যার আপনি শুনতে পাচ্ছেন স্যার?
Okay, let me, as I heard that you are hearing me, but I cannot hear anybody. Still, I believe, let me discuss today on the topic of vaccine passport. Vaccine passport has been named in various ways, and there are controversies regarding the definition of vaccine passport. So the synonymous terms are the immunity passport, also called immunity certificate, or recovery certificate, or release certificate in various countries is a document in both paper and digital format, attesting that its bearer is immune to a contagious disease. This is not new for COVID. This has been thought, acted upon for very long period of time, but still সিরাজ ভাই এটা কথা হন না যাবে ভাই, কথা হন না যাবে কি ভালো মাথায় কিচ্ছু নেই। Similar to quarantine, public certification is an action that governments can take to mitigate an epidemic. A vaccination pass or passport is documentation proving that someone have been vaccinated for COVID during the COVID time, which is now thought about. Some versions will also allow people to show that they have tested negative for the virus and therefore can more easily travel. The versions being worked out now by airlines, industry groups, non-profits and technology companies will be something you can pull up on your mobile phone as an app or part of your digital phone. The earliest concept of immunity certificates, which is now synonymously used for vaccine passport, are a legal document granted by testing authority following a serology test demonstrating that the bearer has antibodies making them immune to a disease. These antibodies can be either produced naturally by recovering from the disease or triggered through vaccination. Such certificates are of practical use only if all of the following conditions, for example, are satisfied. That means patients recovered or vaccinated have protected immunity that prevents them from being reinfected. The protective immunity is long-lasting. The pathogen mutates sufficiently slowly for immunity to work against more strains. Immunity tests have low false positive rates. So if reliable certificates were available, they could be used to exempt holders from quarantine and social distancing restrictions, permitting them to travel and work in most areas, including high-risk occupations such as medical care. But the problem with COVID time is that the antibodies are not uniformly elevated in patients who have been vaccinated or who have been infected with the virus. Despite absence of antibody, these people are protected from COVID because of a cell-mediated immunity. So though the traditional definition says that they should have developed antibody against the disease and they can be given an immunity certificate, But now for COVID, there are various ways people in various countries have tried to produce vaccine certificates. For example, New York State requires professional sports venues that host fans to use Excelsior Pass or similar methods to confirm if attendees have been received one of the following. So they gave so-called vaccine passport or immunity passport to, to people who had a full course of COVID-19 vaccine. One. Number two, a negative PCR test within last 72 hours. And number three, a negative antigen test within 6 hours. So presence of any of these three proof certificate will be considered an immunity certificate for people of New York attending, say, sports venue or concerts or other programs. So a small and medium and such type of Excelsior pass or proof of health status permitted to reopen high capacity venues and in some cases with up to 250% more attendees. So historically, quarantine has been used since ancient times as a method of limiting the spread of infectious disease. Consequently, there has also been a need for documenting, attesting that a person has completed quarantine or is otherwise known not to be infectious. Since the 1700, various Italian states issued a certificate called Fede di Sanità to exempt their bearers from quarantine. So it is more than 300 years that people tried to use some sort of immunity certificates to allow them to move. So it's nothing new that immunity certificate or vaccine passport, which is much talked about now. So you'll wonder that the earliest advocate of immunity passport during COVID-19 pandemic was a person called Sam Rainsy, who is a Cambodian opposition leader. In exile and under confinement in Paris, he proposed immunity passports as a way to help restart the economy in a series of articles which he began in March 2020. So the landmark is said to be March 2020 when an Cambodian opposition leader in exile have proposed the concept of immunity passport or vaccination passport. And his articles published in the Geopolitics and the Brussels Times. The proposals were also published in France, and the idea became increasingly relevant as evidence of lasting acquired immunity became very clear with COVID. In May 2020, Chile started issuing release certificates to patients who had recovered from COVID-19. But the documents will not certify immunity. Many governments, including Finland, Germany, UK, and the United States, have expressed interest in the concept. Israel has already implemented a green pass system which allows those who are fully vaccinated or otherwise have recovered fully from COVID-19 to eat at restaurants, attend concerts, and travel to other nations like Egypt, Cyprus, Greece, etc. The issue has ignited political controversy, leading researchers to wonder, has the phrase vaccine passport become politicized? Truly, in mid-May, the European Union confirmed it had reopened to fully vaccinated travels this summer. They have already lost a year, including Americans. And 7 EU member states, Bulgaria, Czech, Denmark, Germany, Greece, issued the first EU digital COVID certificates on June 1, 2021. Non-EU member states such as Iceland, Norway, Switzerland, etc., will also use the green certificate, but not the UK yet. Under the vaccine passport scheme, the EU member states would adopt the same entry requirements for visitors. The digital COVID certificate will show that a person has been vaccinated against COVID-19, received a negative test result, or recovered from the virus. Any of the three can qualify to achieve a vaccine passport. Fully vaccinated travelers would be allowed to entry to each EU country without the need for a further COVID test or quarantine on arrival. So in European type, the term vaccine passport refers to a type of smartphone app or other means of verifying your vaccine status to travel or gain access to other spaces. Any documentation that proves you have gotten your COVID vaccine can be considered a vaccine passport. While you can always show your paper vaccine card, several companies are working on other ways to verify your health status. So, despite its name, the vaccine passport or the vaccine certificate likely won't be like a little booklet you present to immigration officials when you cross an international border. So, it's not going to be another passport or another booklet like yellow fever vaccination card. Rather, the most probable concept is a mobile application with a scannable barcode that shows your vaccine status. The app could also allow you to check entry requirements for a country, possibly after uploading your itinerary, and hold the status of your last COVID test and maybe other health information. For people without smartphones, some proponents are pushing for an alternative paper version. There are many advocates for the vaccine passport, and there are many opposers of the vaccine passport. For example, one of the controversy arose is that will all vaccines qualify? So the European Union has qualified only Pfizer, Moderna, and Johnson. That did not qualify the Sputnik or the Sinopharm. And some other countries have included Sputnik V and China Farm. WHO is also exploring how a vaccine passport might work. At present time, it is WHO's position that national authorities and conveyance operators should not introduce requirements of proof of COVID-19 vaccination. And also, WHO confirmed the opinion in a statement in an April 15 meeting that the organization does not recommend that countries require proof of vaccination as a condition of entry, given the limited, although growing evidence about the performance of vaccine in reducing transmission, because it is not sure how far the vaccinated population can carry the virus. So they are still asking for a COVID test. And the reason WHO opposing is that the vaccine does not have enough evidence of carriage of the virus, and that this vaccine passport may create an inequity in the global vaccine distribution because of the global vaccine distribution. So I will now talk of some of the arguments in favor of vaccine passport and some of the arguments against a vaccine passport. So the advocates for vaccine passport bring about a that this is the only way to bring about a long-awaited return to normal life. These are the proponents say that this is only the vaccine passport which can open up to normal life post-COVID. Vaccine passport would encourage people to get the shot quickly, they get the vaccine, which would reduce COVID-19 transmission. So this is another benefit of the COVID uh, vaccine passport. It will better protect the frontline workers in the medical, travel, hospitality, and service industries, and everyone else around you. So it is people are going to acquire this certificate, and it will improve the coverage of vaccination. And the vaccine passport is the only way to allow countries to fully reopen the economies. The problem, though, is that these reasons are not perfectly in line. So which will be prioritized, and that's something will have to be decided. The argument against the vaccine passports are also very strong. And the most important argument is that this could result in inequality and discrimination. Not just for people in developing countries where the vaccine is less available, but for richer countries that have been slower to inoculate its residents. So that is the reason that if we restrict for vaccine passport, it will create an inequity in the society because many people still did not get the vaccine. The second thing is a moral or ethical, that a vaccine passport would be unfair for communities who are less trustful of the vaccines and those who decline the vaccine for religious or cultural reasons. So it is going to be unfair to those people who did not accept the vaccine for the perception and who are not taking vaccine for religious or other cultural reasons. So this will create an inequity for those people. The other very important point is that privacy advocates are concerned about the security of the apps that will hold private critical information about a user's health. So in USA, the most important concern is that this will be divulging information regarding health of a person when he's there. It would be yet another app loaded with personal data that could be vulnerable to hacking or misuse. Many app developers counter that they are securing the apps through blockchain technology, which means the data won't be stored in one place, it will be stored in many different places. But the people are concerned that his movement details, for example, in which airport he was, at what time of the day or date, and where he has moved, all this movement information can be divulged through the use of this app. And that is the reason that in many states in USA, they have banned the provision of vaccine passport. As the vaccine doesn't bring total immunity, it could bring a false sense of security and lead to risky behavior and the rise of new COVID-19 variants. It is proposed that variants could come out in patients who had ineffective vaccine. And that's why we know that it is ineffective in about 5% of the patient or maybe more. If used for everyday activities, it will lead to coercion of vaccine. So vaccine না দিলে আপনি কাজ করতে পারবেন না, এরকম একটা coercion may come out of the vaccine. So these are the points against vaccine passport, which are very strong, related to equity, related to cultural beliefs, related to laws of privacy of information, related to that the vaccine may not bring total immunity and people may feel extra secured because of the vaccine, and it may increase the number of variants, and it can continue, it can give rise to sporadic small epidemics. So one of the President Biden's executive orders aimed at curbing the pandemic asked government agencies to assess the feasibility of linking coronavirus vaccine certificate with other vaccine documents, not as all health document that has been proposed by EU and WHO also. So they want it to see as a vaccination certificate only, which will be app-based, which should be verifiable, and that Denmark's government in February that the next 3 to 4 months it will roll out a digital passport that will allow citizens to show that they have been vaccinated. So it is just there are many other problems also, that the problem of we say the problem that the app has to have data, clear, correct data from all countries of the world if it has to be used as a global. So that is a difficult situation to make it in one single format. And if we give only in app form, the people who do not have the app for whatever reason, they are discriminated. So the app should be, and there is laws of privacy of information. So the challenge right now is creating a document or app that is accepted around the world, that protects the privacy and is accessible to people regardless of their wealth or access to smartphones. This is the app which is required. That it will protect the privacy. It will be accepted worldwide. It is accessible to people regardless of their wealth or access to smartphones, because many people cannot use smartphones. So the WHO doesn't recommend vaccination proof as a requirement for international travel, citing unequal distribution of vaccines, even as it consults on interim guidance for developing a smart vaccination certificate. So WHO is also trying to move forward with the vaccination certificate, though without producing laws of privacy, laws of equity, etc. Keen to avoid losing another summer of holiday revenue to the coronavirus pandemic, the European governments, some Asian governments, and the airline industry are scrambling to develop so-called COVID-19 vaccine passports to help kickstart international travel. So still we do not have, but there are organizations who are moving forward, who invested money in developing this software, such that the reopening of the borders, reopening of the international travel, reopening of the business and other sports, vaccination certificate could be an option if it can be simplified, if the privacy can be maintained, if it doesn't make laws of equity, laws of self-respect for the population. So they are working on systems that will allow travelers to use mobile phone apps to prove they have been vaccinated, which could help them avoid quarantine requirements at their destinations. But the multiple efforts underscore the lack of one central international system to electronically verify vaccination status. The projects also face technological challenges in working together, while questions about privacy and vaccine inequality linger. So, in totality, in conclusion, that vaccine passport has been seen as an option to reopen the economy around the globe. But there are still bottlenecks, there are still hurdles to cross to prevent discrimination of population for who do not have the vaccine passport, to avoid breach of privacy of health information of the population and people. So, but the world is moving forward, including WHO is taken steps such that a safe vaccine passport usable around the world can be developed in the near future. With these few words, thank you very much. Thank you for giving me a long hearing. Maybe it was boring to hear because of the no slides. Still, I regret for that. So thank you very much. Thank you for your patient hearing.
Thank you so much, sir, for your amazing presentation. Now it's time for the question and answer session. These are the questions that you asked in the comment section during the live session. I firstly apologize we won't be able to answer all the questions as the time is short, but we will try to answer as much as possible. Now I would like to request our moderator sir to start the question and answer session. Dr. Pankaj Kanti Dutta sir.
So I like to thank Professor Ridwanur Rahman sir for this nice and beautiful deliberation, which is full of updated knowledge. I'm very sorry I was not audible earlier. So now the question answer session. There are some question in the chat box. One is from Dr. Atik Mahmood Jaman. He asked, "Sir, what is the status of vaccine passport in our country, and what will be the validity after taking both doses of vaccine?" I'm requesting Professor Ridwanur Rahman sir.
Status of the vaccine passport in our country, I have no idea whether Bangladesh. It will be a problem for us because we have only less than 4% of the people who receive first dose of the vaccine, and only few people. If we could have, we do not have record of all the cases because we are doing very small number of tests. So it is another challenge for Bangladesh, that Bangladesh will be delayed in entering the vaccination passport process, even if the WHO and other organizations come up with an app. I cannot hear you. That's why I am seeing and I can respond. If you show me the question.
Can you hear me now, sir? Hello. Can you hear me now?
Okay, Pankaj, please, you go to the second question.
Yes, sir. Second question from Dr. Faiz. Is there any difference between vaccine passport and immunity certificate?
Sorry, I cannot hear anything. I am not sure what you are.
Well, you see, Ridwan Bhai, can you hear me? So, you see, today's, the connection is so poor and it's very difficult.
Sorry, I cannot hear you, unfortunately.
Ridwan Bhai, শুনতে পাচ্ছেন এখন? Ridwan Bhai?
Sir,
Okay,
Professor
okay,
Abul
Pankaj.
Azad, I have a question. To the chairperson, Professor Abul Azad.
Okay. Zakir,
Is there any difference between vaccine certificate and vaccine passport? I have got vaccine certificate. I have got vaccine certificate from online. I collected it from online. Vaccine certificate.
Okay, thank you very much. One thing is that the vaccine certificate, that is the most digitized form of your proof.
Why can't you make me hear?
রিদওয়ান ভাই আপনি শুনতে পাচ্ছেন এখন? ওকে, আমি বলছি যে এখন because it's in some of the আপনার ভ্যাকসিন পাসপোর্টে there are records of your total activities during COVID, whether you suffered from COVID and what was the duration when you recovered and everything, and the dose of vaccines. So those are all records and the QR code is there. So in Bangladesh, as we know, the ICT State Minister, Mr. Junaid Ahmed Polok, during April, he mentioned that we'll develop a vaccine passport. And afterwards, after completion of 2 doses of vaccine, our Directorate General of Health Service is providing this certificate. They are mentioning that this is certificate. So this is a paper document. So this can be in any form. I think this is equivalent to the vaccine passport. because it is containing a QR code. So if you have got this QR code, so it will work like that, what is being told as a vaccine passport. So I think in our country, they are doing very good regarding,
but
though a small number of people.
It is different for immunity certificate. Regarding immunity certificate, we must do antibody titer.
You know that this vaccine passport is provided to give the proof of three conditions. One is that you have got the vaccination, and number two that you have got a negative test. Number three, you have got the proof of recovery. So proof of recovery. These are the three conditions by which you can be allowed to get a vaccine certificate or vaccine passport to travel in places where the people are there, or you go abroad also. So that is that. Those are the three things.
Now, I did not have COVID infection. Then what is the test for recovery?
Well, it's very difficult to be said, because we have seen that after getting 2 doses of vaccine, some people were affected. So immune response, how much it is very difficult. So otherwise, testing for the antibody titer. You were right in the sense. But you know that in the United States, they have given the certificate to some of the vaccines, as Professor Ridwan said. So some of the vaccines, which are like your Pfizer, Johnson, and Moderna. So they are also the vaccines which are certified in Europe. And in Europe, people are having your vaccine certificates for moving across the border, like Bulgaria, Czechoslovakia, Denmark, Germany, Greece, Poland, Croatia. Some are over there. So they are all working. And also New York has given the vaccine passport. But 7 of the states in the United States, they have said, no, we don't want to give any vaccine certificate, because it is against the conception of your privacy. So that is another point. And also they have banned, like Alabama, Georgia, some of the states in the United States. And in May 17, United Kingdom already allowed COVID vaccination certificate or vaccine passport to their population. Thank you very much.
Now, so vaccine certificate and passport is different. Those who are vaccinated must have antibody titer. If the antibody titer is sufficient enough, then they can be issued only vaccine passport. This is whether this sort of activity done in the western part of the world.
No. In the Western protocol, they are even saying that we should not ask a person's person when he's traveling about the vaccine status, because what type of vaccine he received and others. So we don't know. And also about that this antibody titer was not done in the American context, in the UK context, in the general people. But for the trial purpose or for the research purpose, they have gone for the trial. So it's very difficult to say. So we are expecting that the people who are getting the recommended vaccines, so they are well immunized. It has been accepted. So I'm not very sure that whether you have to go for antibody. Maybe one thing is that during traveling, before 6 hours, you can go for a rapid antigen test, or they can measure the antibody titer in the airport. So what I have seen in the Emirates queue, in the Dubai airport. So that can also be one of the ways by which you can be said that okay, you can have this vaccine passport. Thank you, Zakir.
Thank you, sir. Thank you, sir.
Thank you, sir. I hope this one conversation could satisfy the doctor who asked this question. There is another question in the chat box from Muntasir Ahmed. This question, he asked a question to Professor Dr. Zakir Hossain, sir. Is evidence of vaccination is enough in vaccine passport, or antibody titer is needed?
This was discussed. Just I know.
Now, ठीक है से evidence of vaccination, and if it is associated with the antibody titer, that should be best one for issuing vaccine passport. But there is still no rule or actual কোনো নীতিমালা এখনো ডেভেলপ করে নাই। আর বাংলাদেশ সরকার এখন ভ্যাকসিন পাসপোর্ট না, ভ্যাকসিন সার্টিফিকেট দিচ্ছে। জাস্ট ভ্যাকসিন কেউ যদি সঠিক সময়ে সঠিক ডোজ অ্যাডপ্ট করে তখনই সে ভ্যাকসিন পাসপোর্ট সার্টিফিকেট পাচ্ছে, এবং দ্যাট ইজ আই থিঙ্ক ইকুইভ্যালেন্ট টু ভ্যাকসিন পাসপোর্ট ফর আওয়ার কান্ট্রি, ফর আওয়ার পপুলেশন।
Sir, thank you, sir. The last question from one of our audience, sir. There is an ethical principle of justice or equitable distribution. Is there any chance of breaching this principle in case of vaccination passport? Sir, is there any chance of breaching the ethical principle of justice in case of vaccination passport? Probably most of the people of the world are beyond the reach of vaccine. So this raises a question of justice.
Well, এটা ফয়েজ স্যার বলতে পারেন। ফয়েজ স্যারকে আমরা কোশ্চেন দিই, যেহেতু রিদওয়ান ভাই নাই। আমি আমাদের সম্মানিত স্যার ফয়েজ স্যারকে দেখতে পাচ্ছি, স্যার এই আনসারটা করেন স্যার।
So shall I repeat this question, sir?
Well, I understood it. Well, Honorable Chair.
Sir,
Walaikum Assalam, and the present governor of SAP Bangladesh chapter, keynote speaker Professor Ridwanur Rahman, relevant expert Professor Zakir, and those who are listening. Assalamu alaikum and good evening. I think the term quote unquote vaccine passport is a misnomer, because there is no consensus yet on COVID vaccination passport issue at WHO level. As mentioned by Professor Ridwanur Rahman, he highlighted some terminology about access, equity, and ethics because of many critically unknown things. For example, there is no proof that antibody level is equivalent to protection, because there are already 4 or 5 variants emerged from different parts of the globe and still continuing to emerge. So this is something, a chaos, scientific chaos. This terminology brought scientific chaos, and really the audience who asked this question, I think his question is very much relevant, because on the one side, the low middle income countries, some of the LMIC are struggling hard for addressing substandard and falsified COVID-19 vaccine. SF, some countries are struggling hard, and on the other side, the other countries are struggling so that their citizens can go to the pub, can go to the restaurant, entertainment, gymnasium, workplace, or traveling to abroad for tourism. On the other side, some of the LMIC, our citizens are struggling hard to travel abroad for attending their job, by which they are earning money, hard earning money to sustain the economy of their home country. So I think in this situation, the vaccine issue, the vaccine passport issue is a slippery slope. Our Honorable Chair mentioned that there are 3 components of so-called this vaccine passport. One is the 3 components. One is vaccination status, and you know the vaccination status is not equivalent to antibody because of the emerging issue of this variant. Then the latest test result, and this is through RT-PCR, not by antigen test. And third one is COVID recovery status. And Professor Zakir rightly mentioned that if I am not, I didn't have any COVID disease, then what will be the COVID recovery status? You know that many patients, they do not have any symptom. And the Professor Ridwan mentioned about data privacy issue. So there is a huge area of discrimination and equity concern on this part of the ethist. And I think now we are trying to develop, instead of an equitable society, we are trying to develop a two-tier society. Those who are vaccinated, those who are not vaccinated. And our countries, many LMIC, are struggling very hard even to provide vaccination to their very frontline citizens. I'm not talking about Bangladesh. So I think this is a very serious discriminatory issue, ethical issue, and until the global community accept it as a equivocal proved COVID vaccination status and other components, then we possibly this will be a quote unquote this vaccine passport, and I think we shall wait for the global recommendation of this terminology. And if time permits, later on I shall talk about it. Thank you very much.
Sir, to add
Thank you,
this
sir.
one, sir, you are right. You are right, Pankaj. Just for a while, who is trying to make a guideline for this vaccine passport, sir? You know, sir. So if the guideline is published, then definitely our committee in Bangladesh will try to work on this issue, sir, and then we'll try to advocate a common policy for our general people. And as because you mentioned a very pertinent point, very burning point, that the people who will go for work outside Bangladesh, definitely we have to consider them as the most important, and it's a burning issue, sir. Thank you so much, sir, for bringing this into the focus. Thank you. Okay, Pankaj, please.
Thank you, sir. I also like to thank our viewers to have warm participation with excellent questions. Now it is time to comment. So I like to request Professor Mohammad Abul Faiz sir to have his valuable comment on vaccination passport. Thank you, sir.
Well, thank you, Dr. Pankaj. Already I talked a little bit, but as I mentioned, to give me as an opinion, I think it is very nice, and I would like to thank SEP Bangladesh chapter to have this teaching session and for the various healthcare professionals with specific reference to postgraduate students of our region. And it is indeed a very thankful job for the professionals, particularly the learned society like SEP Bangladesh chapter, and also Professor Ridwan for delivering a very succinct, very comprehensive, different type of presentation, which attracted lots of audience. Sometimes we read slides, people become bored. So I think in this new technology, he tried to persuade us to continue to work on a conventional delivery of the sentences, which are very much relevant, pertinent, and important catchy points, as the bullet point he has highlighted, various intricate components of the vaccine passport. Today we are talking about the vaccine-related issue, which can be utilized in future for the global community, that to have a safe community, safety for travel. Particularly, the IATA was very much interested in introducing this vaccine passport. But the global community, particularly the Global Health Authority, the responsibility lies on the World Health Organization. There is still no consensus about the terminology, the vaccine passport. But some countries, they have introduced it, and even in the European Union, they have got different terminology, different green pass, like something like that. So I think we shall wait. We have to have some patience to introduce this vaccine passport in Bangladesh, and also particularly in a situation where there are even not a consensus whether this will be through the digitalized way, whether it will be a health wallet, or it will be a bits of paper, or some of the government documents. So there are at least four options, not only the digital travel pass. So think about, I was reading one information that think about an airport where the passengers, 200 passengers are coming. Some are coming with travel pass, with the digitalized, some are coming with health wallet, some are coming with the bits of paper, some are coming with some of the government documents. There will be a chaotic situation. So I think for those countries who are not entertaining travel without having confirmed status of vaccination, I think we have to follow, we have to abide by. But till the WHO adopt it, I think we have to be a bit cautious in introducing in general, because if without any documented the travel pass with authenticated coding, then possibly there will be possibility of having fraud. Countries LMIC are associated with this terminology of this fraudulence and the scientific activities. These are more or less not synonymous. So there is likelihood of having this type of activities in those countries. I think we have to be very cautious because we are having vaccine from three different varieties. Fortunately, we are having vaccine only through the government channel. This is very much appreciating. We must appreciate that, because if we open it in the sector, some countries opened it. Even Thailand didn't open it. Some countries opened it. Now they are facing lots of problems related to the falsified this vaccine. And also that vaccine, for example, -70 degree. Some of the vaccines are required temperature like that. So how that this will be up to the receiving and the temperature there are many issues related to vaccine which are more relevant than this type of issues. Are we diverting our attention to something else? I think we have to have our precious time concentrating on some of the globally important, locally relevant, important public health components related to vaccinations, coverage, access, equity, particularly the acceptability, the vaccine hesitancy, the side effects, continuously monitoring. There are so many issues we have to work for hours together. I think this to me, it is a footnote talking about, but we are thankful to SCP for bringing this very important issue. I think I would like to end here with profound thanks to the organizers for organizing this session, and also kindly asking me to attend this webinar and listening to the very gorgeous learned speakers and specialists, the resource persons in this session. Over to you. Thank you very much.
Thank you, sir. Thank you, sir, for your nice and informative speech. Now it is time to hear from our another panel expert, Professor Mohammad Zakir, sir. Sir, please.
Thank you. Honorable Chairperson of this session, Professor Abul Kalam Azad, Principal, Popular Medical College, President, ACP Chapter Bangladesh, my direct teacher, Professor H.M. Nazmul Hassan, Speaker, Honorable Speaker, Professor Dr. Ridwanur Rahman, another panelist, my direct teacher, ex-DG, Professor of Medicine, Professor Abul Faiz, sir, dear moderator, Assalamu alaikum. Regarding COVID issue, that is COVID-19 infection, there are lots of politics. Also politics about vaccination program. Total world population, and only less than 20% of the population, less than 20% or less than 15% population in the developed countries. And most of the vaccines they are getting. But the rest of the 80% of more than 80% of the world population still not getting vaccine. But for their safety, for the safety of the developed country or population of the developed country, I think all should be vaccinated. Fraction of people, if vaccinated, cannot be saved, because the whole population of the world now in a same country, I think. They are traveling all the time. They are doing many activities alone, combined. Again, in our country, it is very easy to get vaccine certificate from online. So vaccine certificate, I think we should have all those who are vaccinated should have vaccine passport, the vaccine certificate, and it is, I think, equivalent to vaccine passport for our people. In this regards, I think WHO should play important role, and WHO should come forward for vaccine for poor people, recommended vaccine. Our government trying at their best for importing vaccine, at the same time for producing vaccine to save our people. There are lots of myth, negative propaganda about vaccine. I think there should not have this sort of propaganda. Our printing and electronics media should come forward that all should have vaccination, irrespective of age, irrespective of sex. All should have vaccination, and there is no serious side effect about vaccination. I think all will be motivated, and within very short period of time, that is in next 2 or 3 months, we can able to produce vaccine, and our peoples, I think, will be vaccinated, and in that case only our economies will be improved. So for development of good economy, for improving economy, vaccination no alternative, and we will try, our government will try, WHO should come into action so that poor peoples of the world will get vaccine. So for preventing, for defeating COVID-19 infection, no alternative other than vaccine. And along with vaccine, we should have mask, hand wash, and social distancing. So we should emphasize on masks, hand washing, and social distancing until we are not getting vaccine. Thank you, SCP, Bangladesh chapter, for arranging such session and selecting me as panelist. Thank you all.
Thank you, sir.
Thank you,
We are
sir.
near the end
We
of the
are near the
session.
end of the
Now,
session. Now,
now it is time
now
for
it's time
concluding
for concluding
remark and
remark
concluding speech
and
from
concluding
our
speech from our
chairperson.
chairperson.
Before that, I'd like to thank SCP Bangladesh chapter for selecting me as a moderator of this session, and uh, I am very much privileged to attend here, and it is always always a uh, place where we get updated and knowledge and information from our respected teachers. I also like to thank our chairperson, Professor Kawser, and our distinguished panel expert, and today's speaker, Professor Ridwanur Rahman sir. And it is always a, a beautiful thing to hear enchanting voice from you, sir. So now the concluding remark from Professor Kawser. Thank you, sir.
Thank you very much. Thank you, Dr. Pankaj, for your excellent moderation. And it was so wonderful. And I'd like to give thanks to the SCP chapter Bangladesh, especially our governor and the team working with him to arrange for such a series of health talk, and especially by your great teachers of our country. And that's it is always very soothing and very comfortable, very informative and illustrious lectures from our great teachers. And one of the teachers, Professor Ridwanur Rahman, was today's speaker. Where he was traveling, and but he did not leave the job, and he found a place and he started talking. Thanks, Professor Ridwanur Rahman. He talked on so many things, and a new thing. This concept is a very new thing, but it is very important because in the future plan, people have to think of this type of your passport in the future. And also today we have got two great scholars. Our a teacher of the nation, Professor M. A. Faiz sir, who who has got a very great deal of knowledge regarding this sort of things, because he was Director General of Health Services. So he knows the policy, programming, and also very important things. So he mentioned so many important things in his lecture. Thank you, sir, for your brilliant presence, and definitely your speech was very, important for the students, for us, and also it produced some guideline for the future programming to make a COVID passport in our country. And also we have got Professor Zakir Hossain. He is a very great scholar teacher, and also always busy with teaching people, and also very good organizer. And I love him like anything. And he is also here today, and he made so many good comments. And definitely, it is very important. And also the anchor Dr. Prince was there. Thank you very much, Prince. I found Dr. Sharmista was there. Thank you, Dr. Sharmista. And also the people who were present. And definitely your participation is very important to continue this type of program. And definitely very new things are put here. And probably 2 days back you have seen that conflicts of interest was there as one of the topics. And today we found that is very important, that vaccine passport. So it was discussed by Professor Ridwanur Rahman, and definitely we got some idea, and some questions were there. So definitely these are very important points to be answered in future if we want to consider this vaccine passport. We don't know, we are not very sure whether equity and justice will be confirmed by this vaccine passport. And for this, we need the vaccines to be given to everybody in every country in the world. So that is one of the important issues which was also discussed by our speakers. So I hope, I'm not going any further, but I'll be expecting that every person in the country will be effectively vaccinated, and there will be a way by which the vaccine passport can be formulated and can be a working tool for the people to move freely, not in only this country but from country to country. That is very important, because for so many reasons, for business, service, tourism, and so many other things, the people are moving. And also the students who are studying abroad, for them also it's very important. So to keep the relationship with other countries is also important. So in the future, we'll find a very good answer. Hopefully, the next 2 months are very important in our country. And then in the 2 months, we'll find what the situation of COVID is, and the number of people who are getting vaccination, and the types of vaccination being provided, and also the hospital facilities being provided for treating the patient. Also, the people security in the form of the correction of the people's behavior for their movement and others. So as Professor Zakir rightly mentioned about that, in the future also, with or without vaccination, we need to provide a very good health protective measures, that is social distancing, mask, and also hygienic protection. So with these few words, I'd like to give thanks and my gratitude, my respect to our, the Professor H.M. Nazmul Hassan, who is a guardian of our students, who has got a benevolent mind, who thinks of the benefit of the students, and so he has brought so many important issues. I like to congratulate him for his this efforts. So with these few words, for everybody in our show, I like to give thanks. So hoping to meet you soon. Thank you very much. I like to conclude here. Assalamu alaikum.
Sadly, we have come to the end of today's program. We have learned so many important things about vaccines from sir today. Many thanks to the speaker, the chair, the expert panel, and last but not the least, the moderator sir, for managing time for this program from their very busy schedule. I would like to thank all the audience who were with us throughout the event, especially those who asked very important questions. Hope you got your answer. If you joined late or couldn't see the whole program, there is no need to be worried. You can find the whole program on our YouTube channel right after the live session finishes. Our next masterclass will held on 8th of June, where Professor M.A. Jalil Choudhury sir will discuss on the topic General Diagnostic Approach on Shortness of Breath. So, see you all on the next episode. Until then, good night and take care.